The next course would be focused on PET-CT, FDG PET-CT, describing the anatomy, of course, detailed anatomy, and how to approach the PET scans, basically. Instead of just doing an FDG PET scan, for example, in lung cancers, you would do an FDG PET scan. Then you would recommend to do a contrast-enhanced CT if the lesion or the mass was not properly visualized. You need to measure it and you need to see the margins and all that. No, you can do all that in one PET-CT scan instead of just recommending to do another CT scan and all of that. So it would definitely help the referring physician instead of delaying the patient's treatment and all that. This is what we do at our institution. We now do PET-CTs, and we do, if the patient doesn't have an HRCT, for the chest, we would do it with the PET-CT instead of just recommending to do it again with contrast.
Okay.
So I'm gonna do another course for PET-CT on how to describe the anatomy and the findings and all that.
Do people still do PET-CT without intravenous iodine contrast? So like unenhanced CT, is it still done?
Yeah. A lot of institutions and centers, especially in this region, they just do a low dose CT for localization, and you end up with these findings that you don't know how to describe. They would just recommend to do contrast enhanced CT or MR, and that's gonna delay the patient's treatment. You're gonna need an appointment to do different imaging. So instead of just doing all that, you can actually describe or tell the referring physician what is going on with these patients instead of just wasting their time.
That's, I think, will be very useful also for radiologists, as they also sometimes need to demonstrate PET-CT scans in their clinical rounds, in their case demonstration sessions. I don't exclude myself. I also show a lot of PET-CT scans for the rheumatology colleagues, and it's always a challenge to go through all these structures. Yeah.